Welcome, everybody. I'm Lydia Isaac. I'm the Vice President for Health Equity and Policy here at the National Urban League, and welcome to the December 2024 Health Equity Webinar Series. We are so lucky and I'm so excited to have our guests with us. We are doing our this month on HIV prevention in honor of World AIDS Day, which was yesterday. World AIDS Day is always on December 1st, and so we wanted to make sure that we did a session that honored World AIDS Day. We are so lucky to have with us two just distinguished scholars in this field, one who is a dear friend of mine and the other who is the friend of a dear friend of mine. And I'm going to let them introduce themselves, but we have Dr. Vignetta Charles, who is the president and CEO of ETR, and we have Douglas Brooks, who is now a fellow at the University of Pennsylvania, but was the director of the National Office on AIDS Policy under the Obama administration and really advanced the work of HIV prevention during his time there. And so we're just honored to have him to discuss what's going on in HIV prevention, what's going on around the world, and particularly in the US, and how we as an Urban League movement can support the work of the National AIDS Strategy and ending the epidemic. And so I'm going to let Douglas introduce himself first, and then Dr. Charles.
Hi, I really am thrilled to be with you. I am Douglas Brooks. As Lydia just said, I'm currently a senior fellow in the School of Social Policy and Practice at the University of Pennsylvania. I'm a social worker by training, and I'm happy to be here. Yeah, I've been doing this a long time, and and glad to be with two really smart women. So, Dr. Charles.
That's hilarious. I feel like I should do your bio. I was like, that's really, yeah. So, Douglas Brooks is certainly one of the leading voices in the HIV prevention and care and advocacy for at least the past 3 decades, and certainly I think has always taken a very intersectional approach, including his time as VP of JRI Health in the Boston area, and certainly when we met each other now many decades ago, it's like in service on first the AIDS Action Council board and Public Policy Committee, and then later as on the board, and then served as the board chair of AIDS United, which is a leading formative research, grant making, advocacy, and organization in DC. And
you and I got stuck running the place.
Right, exactly. And so, and then when he was board chair, we were in a search. And so Douglas and I ended up being quite close because I was senior vice president at the time. And so there was a window of time where he was practically our interim. And so his leadership across the HIV movement includes certainly that sort of CEO-dom as well. And then, as you mentioned, Lydia, obviously the director of the Office of National AIDS Policy is the sort of most recent esteemed engagement. And has been a mentor and friend to so many of us in the movement. So that's what you should have said about yourself. That is I'm Vignetta Charles. I'm the CEO of ETR, which stands for Education, Training, and Research, and we develop science-based products and services in many areas, but HIV being one of them since the beginning of the epidemic. I've been the CEO of ETR for 8 years. Before that, I was the inaugural chief science officer, and before that, I was senior vice president at AIDS United, which is where I met Douglas. And I was also on the President's Advisory Council for HIV/AIDS, PACHA, which advises the White House and HHS on matters related to HIV from 2014 to 2017. Yeah.
Fantastic. I love it. I usually don't like to read the bios because they are like sometimes long and people sit them. I like to hear what people have to say about themselves, but I appreciate Vignetta for saying what Douglas didn't want to say about himself. But so I'm going to start off with our first question because I think it's important, including the legacy that you both have during this movement. So the theme for this year's World AIDS Day was collective action, sustaining and accelerating HIV progress and prevention. And so what does that mean? What does that theme? Why is that so important for us to have collective action when it comes to the work of HIV prevention?
Want me to go? I'm happy to try to kick it off. First, let me say thank you to the participants who are on this webinar. The National Urban League is an organization that I greatly admire and revere. When I was living and working in Boston, the Urban League of Massachusetts was a huge partner to us. I think both Massachusetts and Boston, maybe there's a Boston chapter. Yep. The always willing to join with us in collective action to address HIV and use the Urban League's power and credibility to open doors. And so I do think that's exactly what it is. It is building relationships and partnerships to serve our people. I should say I'm a person who does not pull back from saying my people. Most often when I say that, I mean people who are Black and brown and people who are along the queer spectrum. And I feel like that's also part of who the Urban League is and what the Urban League is. And I think at this particular time in our movement, in the work, collective action will be the only way anything will get accomplished. And what we cannot do is allow any backtracking. We've already been a group of people who have faced inequities, injustices, and disparities. I'm not a person who believes in labeling it all, it ain't all been a veil of tears. We are also resilient and brilliant, and look at what we've accomplished in spite of. Imagine if we didn't have to deal with all that other stuff, I'll call it, what we people would do. We are kings and queens. So it will be substantively, we need all the folks who are on this call and people throughout the US in Urban League and elsewhere to stay with us to, at a minimum, maintain the traction and the accomplishments that we've achieved, but hopefully to also move us forward in prevention, in treatment, in care. We still are stuck with we're still stuck with stigma. It's still very, very real in our communities. I could tell 100 stories about that. I'll stop here and Vignetta, and then we can all chat.
Before Vignetta goes, I want to, because it's actually a question I had for you, so it's a good follow-up about you talking about my people. When you talk about my people, you talk about Black and brown people. And what I particularly want you to talk about is the idea when you were working not only at Gilead, but also at the national office, about the focus on the southern states and why that was so important to focus on in this country, in the United States. We'll talk about the world a little bit more, the southern states. And so I think that's important because it's about our people. So I'd like you to talk about how you got that strategy to go forward. Was there any resistance to it, and how did you overcome that resistance? And why is it so important to focus on southern states?
So thank you. All really, really important. I was fortunate actually, and when I went into the White House in 2014, there were three of us under President Obama, actually four. The first AIDS director, Jeff Crowley, and Greg Millett had developed the original strategy, and it was a 5-year strategy, 2020 to 2015. So when I went in 2014, I was fortunate in that I knew what I had to do. We had to, first of all, have to say, we're not doing a new strategy. We're going to update the strategy. But there were some significant things that needed to be updated. The previous strategy had certainly focused on disparities. I was able to go deeper. We were able to really call out, if you were to pick up that document, you'd see Black at least 1,000 times, I'm sure, because that's where I can put it, I'm putting it. But notably, Black gay men, Black women, Black transgender women, and we were able to put an address and put some goals and metrics to achieve advances for in prevention, care, and treatment. I was also really fortunate in that yesterday we were just talking before you all came on. Uh, Many of us were at the White House for the World AIDS Day commemoration, where the National AIDS Memorial quilt was on display. Panels from that quilt were on display. And just standing around with all these people who do the work and are engaged in it, it was very powerful, including Dr. Fauci, Tony Fauci, and his wife, Christine Grady, who I always say is equally as accomplished as her husband on her own right. Christine and Tony were there, and I got to say hello to them. Dr. Fauci really partnered with me. He let me, and he anything I asked him for, he said yes. And he worked really hard, and particularly, he said, by the time you're ready to, he asked me, he usually would come to the White House, but he asked if I would come out to NIH because he wanted to show me some things. And I got out there, and he brought in some people from his team. He said, by the time you put the strategy out, we will be able to say definitively that people who are on treatment and durably suppressed um, can't pass along the virus. And we at NIH will be ready to sign off on that. At the same time, uh, pre-exposure prophylaxis had been approved for enough. My predecessor, my immediate predecessor, Dr. Grant Colfax, had tried to put that in a document that he put out on medical care, and he got his hand slapped. They would not let him put it in. By the time I came in, same thing. The science was so clear that we were able to include PrEP as well as a tool for prevention. And yeah, it is part of when you're working at that level. I used to say, when you're trying to change something for an entire nation, it shouldn't be easy. You can't turn that easily. It needs to be rough, and people need to push back on you. And so certainly, but the President Obama, and in particular, just share this because she has been very open about it. Valerie Jarrett has a very personal relationship to HIV, and wanted to was as supportive as she could be. And, Valerie was supporting you, the president was supporting you. So, and it was, I should say, when I went into, so there was the original document strategy, there had been pushback from women on feeling not so included in the original strategy. So there was a document on violence against women and HIV/AIDS as well. And then there was the medical, I can't remember the name of it, but there was a medical document that Grant had put out. So we had these three documents we were working for. And the first thing I ran around the building doing was asking if we could integrate these documents. So we didn't have these three things going on. And I must say, small resistance, but for the most part, the woman who at the time, beautiful sister, who was running the Office of Violence Against Women, said, "Oh yeah, I prefer when women are included, not having to be hanging out separately." So we were able to integrate all of that with good science and good measurements. And Vignetta will tell you, I'm a person who I keep saying I'm a person who believes in acknowledging the people who help get the work done. And Dr. Amy Lansky from CDC came up to DC and parked herself in my office and truly led that work and the science of it, and people from HHS. And we were able to build a meaningful strategy. And talk for one more minute. And so when I left in 2016 and decided to go to work at Gilead, I had worked in nonprofits and in government, and 62 now, and I needed to make a little money. And I was hoping to be able to do some good work. And I'd been in discussions with them, as soon as I left the White House and just entering these, and it seemed like they really did want to do what they said they wanted to do. So I took a chance, and not long after I got there, a mutual friend of Vignetta and mine, Korab Zuka, who was overseeing all corporate giving at Gilead, and I got our boss's boss, who is an executive vice president, to go on a trip with us to the southern U.S. We went to Atlanta, Birmingham, Jackson, and New Orleans. And as you can imagine, we had planned with community leaders and said to them, you really need to tell this guy what we need and what's needed. The disparities were so clear. He's a smart man. We don't need to make him help him understand the impact, what's happening to Black people in the Southern U.S. And we had a great trip, and all the organizations and leaders just did a stellar job of helping Greg understand what it was. So much so, I was telling this story last night. When we got to our final stop in Jackson, he said, "Here's what I've heard. I've heard that people need greater access to care. People need to feel safe to come into these environments." And he listed out 3 or 4 things that he had got. He's an attorney by training. And so in that attorney brain, just listed out what needed to be done. And I just sort of, I said, that's exactly what's needed. That's exactly, I'm so excited that you got that. And he said, I'm glad you're excited because it's now your job. And we did. And I think you probably know we were able to put out a $100 million program that's still going very strong, just celebrated its 5th anniversary recently, a few weeks ago, and is doing good work across the South for Black people. And the last thing Greg said was, and they don't need us to do it. They just need us to give them the money to do it. And so we formed these 3 centers. There are now 4 focused on different areas and prevention, care, treatment. One was stigma and discrimination, and then a 4th that we brought on later was on spirituality. And it was, how can you address this with Black people and not have a component that is focused on, and that's at Wake Forest and doing a stellar job as well. So that was a really long answer to a question and around the mulberry bush, but hopefully.
No, it's perfect because you hit a bunch of things. One, we actually just did a webinar last month on spirituality and health. So that wonderful connection. So now, Vignetta, Dr. Charles, I want you to talk about 2 things, the collective action piece, but also
Sure.
advocacy, what Doug was talking about with advocacy and putting the dollars in the community to do the work.
Lovely. I love that. I've forgotten. I used to be on panels with Doug all the time. And so then I was like, oh yeah, it's like, this is what it's like. I said, that is, no, I mean, in the best of ways, right? Because I was like, there are all these things where I was like, oh, see, he already said it. So, so I don't have to say it. I can say different things. So in terms of the collective action, I think we can't do it without a collective. And I think that's always been true since the inception of any sort of HIV programming. It has had to have a collective action because HIV transmission is primarily sex and drugs, which are things that people don't want to talk about. And so the communities most impacted tend to be communities that are systematically underserved and oppressed anyway. And so it has always taken all of us to do this work. And I think I was not on the South Lawn, but I was at the AIDS Memorial Grove Gala on Saturday in San Francisco, and was really reminded, because San Francisco was, certainly one of the epicenters of the epidemic in the beginning, and from that time, the partnership, which had to be advocacy organizations, including the Urban League, right? So certainly had to be the SFDPH, had to be so health departments, the SF General, right? Certainly the UCSF, the academic partners coming together to decide that this was going to be something that we addressed with collective action, and that collective action continues through today. And San Francisco having some tremendous HIV outcomes. I'd be remiss if I did not mention the data and Dr. Vignetta Charles. And so it's like that is, so the data on new infections in some of the urban areas are quite promising, but the inequities still persist even within those. And so, so I can also talk about the Southern HIV epidemic, and would love to, as as Doug said, the data drives you to where the epidemic is persisting and is persisting particularly for our people, right? So for Black and Brown folks especially, and that has been the Southern U.S. And so there's large metropolitan areas, of course, that continue to experience inequities related to HIV, but the Southern U.S. is disproportionately impacted. And so that concerted effort that, Douglas talked about, that certainly has been coming out of the Office of National AIDS Policy in partnership with many folks, including AIDS United, which has a Southern HIV Impact Fund, which is a group of many funders actually supporting making sure that HIV is addressed and dollars are going to those communities to address HIV in the ways that make sense within those communities. And then ETR is also the evaluator of the Compass Initiative that that Douglas was talking about, which is Gilead's $100 million 10-year initiative to combat HIV in the South. And Greg, who he's referring to, is also on my board. So the world is so I say that because the world is both small and large, right? So it's like there are the collective experience of addressing HIV has informed all of my work, which hasn't just been HIV work for the past 30 years. And so it has been about the fact that whenever you're talking about HIV, you will be talking about things that are very relevant to the National Urban League affiliates. You're talking about education, right? So it's like that is, if we do not have effective HIV prevention education, that then it starts there. And we know that is not true in all schools, right? That you have effective HIV prevention education, that you have inclusive, non-shaming, LGBT inclusive HIV education in schools, so medically accurate HIV education in schools. Education is a key piece of many Urban League affiliates. Workforce, major issue within, and workforce development, major issue within the HIV community that has always been intersectional, and again, impacts the Urban League in terms of making sure that people living with HIV are employed, making sure that the workforce that is serving people living with HIV is trained. And so workforce development partnerships with folks like Urban League affiliates have been really key there. And then certainly from a care perspective, HIV has been a leader in understanding that care is not just clinical care. Sort of care, as we see from the success of the Ryan White program, means that you have to have housing stability. It means that you have to have food security. It means that you have to feel safe in your homes. It means that you stigma has to be addressed. You have to feel safe going into an environment to get your care. And so that sort of that social determinants of health approach, which I know is so key to many Urban League affiliates, has been something that's been core to the HIV prevention and care effort since for 43 years since the first official diagnosis. And so that so I'll say those are sort of key pieces that I think affiliates can continue to drive into, because the inequities persist, and the inequities continue to persist, primarily impacting Black and Brown folks. I would note for many affiliates, if you look at the data from the most recent CDC data from 2022, the largest increase in new diagnosis was with our Hispanic Latino colleagues. And so if we're talking about Latinx communities in Urban League, I know we're all Black identified on this call, but we certainly work in solidarity with our Latinx communities. And I would say that when we watch those new infections going up, that is that partnership as a collective, back to your original question, is particularly important because there's some stability in new infections for Black folks. There's still inequities within, right? So for Black gay and bisexual men, Black transgender women, certainly people who use injection drugs, right? So there's the inequities within those categories, but there's been some concerted efforts, and not as much concerted efforts as we've seen for our Latinx communities, and that we work in solidarity with, particularly in our urban centers.
So I think that's,
Lydia,
go ahead.
May I tend to like to include the audience, the people who are there, because we sometimes will, especially this woman and I,
I know we'll
we
go
can
off for
talk
a
for an
long
hour.
time.
Right. And Zana from the Urban League of Portland has asked a question around the persistent stigma and fear in our communities, and what we can do in order to reduce that, to eliminate it, to be able to bring people into PrEP and treatment. And
I was going to get to that, but we could go to it. Go for it.
All right.
No, go for it. Yeah.
A way that I always do, so with lovely all the talk about my bio. I am also a person who has been living with HIV for 35 years now. And I put that out for the specific reason of I feel safe enough and comfortable enough to be able to say that, and so now everyone who is on this webinar now at least has heard the voice and seen the face of a person living with HIV. I think that's a way to help reduce stigma. I also think there's so much shame. There are few ways to contract HIV, and major being through sex, and there's so much shame around sex. And I think sometimes, in particular in our communities, at a pastor in Boston, Reverend Lockhart at Union in Boston, who used to, he would preach about once every quarter or twice a year. Reverend Lockhart would preach on sex, which he called God's good gift. And he would talk about, I think the more we're able to talk respectfully and with dignity around sex and sexual transmission, I think that helps reduce it. But a place where I think we as a movement haven't done as well as we could or should is we often spend a lot of time talking amongst ourselves, talking with each other. We go to these conferences, we go to these meetings, and we should be at the National Urban League's conference giving a talk on this because I think the more we can normalize it, not make it be a shameful thing, not make it, the better. And I had a perfect example of this about a year ago. I was actually doing some work with the Gilead Foundation and went down to Virginia to Pharrell's school. Pharrell has a school, Yellow, and it is, God, it's extraordinary. I could talk about it forever. But after the meeting, went out to lunch with a couple people, including the woman who's the head, the principal of the school. And somehow I brought up PrEP, and she said, "PrEP, what's?" And I started talking, and she said, young woman, um, said, "Why don't I know about that?" Now, so we can't blame that on her. We can't blame her on, we can't say she's not open. All the things we can sometimes say about people who don't hear. This is a woman who has insurance, highly educated, and probably active in her life. And why don't I know about this? So yeah, just getting out of our bubble is a way to do it too, Xana.
So I have
Can I talk?
I
Actually,
have a
can
follow-up that I'm going to talk to you about, but yes, and I was going to direct it to Vignetta, but you might already say it. And then I do want to talk about PrEP and PEP. So go ahead, V.
Okay, super. Well, I was going to do stigma and then going into PrEP and PEP, so I was like,
Good,
maybe I'll
go
just do
for
a
it.
transition there.
Yes.
So I agree wholeheartedly with Doug that I think addressing stigma is key here. So because we're not just talking about sex, which is shamed in our society, but if you're talking about sex that is not perceived as heterosexual sex, right? It was like there's also shame and fear and stigma. Homophobia is real in this country and around the world, and so I think the addressing stigma is about addressing homophobia, I think, and transphobia. I think addressing stigma for HIV is also just when if I was diagnosed with breast cancer tomorrow, I would wear a pink ribbon and I'd get flowers and everyone would come and talk to me about it, and I had all the insurance at my work and all these things. And if I was diagnosed with HIV tomorrow, I thankfully work in a really great environment where that would be addressed the same way, right? In terms of, hey, what do you need? What do you need for your care? What are, what's happening in this world? And that is really not true of most environments, most employer environments, most school environments, most community settings, most faith-based settings. And so we need to normalize that sort of especially with the advances, the medical advances, if you have effective care and early diagnosis, effective care and treatment, you can live just as long as anyone else if you're living with HIV. And so that actually sort of changing perceptions of the disease matters. And then also letting folks know that it's, a disease like any other, so like needs management and needs care and it needs support in all those ways. And the sort of fear and stigma around it, because it's around sex and drugs, and is deeply associated with many phobias, can be really problematic. I think Urban League has a really great opportunity to work to destigmatize HIV, particularly within our Black and Brown communities. And I wholeheartedly agree with Douglas. You should invite us or others to us, like the International Conference, because there's so much that again is intersectional with all of the affiliates' work, and making sure that the affiliates are just as responsible as anyone else in terms of reducing that stigma and making sure that people are getting the prevention and care that they need. Speaking of prevention, PrEP. So I was one of those Black women that went to Doug early on saying that there wasn't enough women in and wasn't enough call out, particularly for the disproportionate impact for Black women in HIV. And also I was an author early on in 2012, right after the FDA approved Truvada as PrEP, where we did focus groups around the nation, and we did a qualitative research and found that most Black women who are at high risk for HIV in those urban centers, it was in New Orleans, it was in Oakland, it was Los Angeles, right, didn't know about PrEP at all. And so and that was 2012, and I would say that continues to be true today in 2024, at the end of 2024, almost 2025. There are efforts here to sort of make that different, particularly in Black communities. And I think Urban League affiliates really have an opportunity there to partner with your local health departments and schools and clinics and community-based organizations and find out what PrEP education is happening there, because it's a preventive measure. And so pre-exposure prophylaxis is safe. We now have long-acting options, right? So the reality of a daily pill can work for some folks, and a long-acting option is better for some folks. And so now there are multiple options for modes of delivery of PrEP that people need to know about and have access to. And particularly when we're talking about Urban League, you're usually in places where there is access to that. I mean, we, Douglas and I also work in lots of places that don't have access, in rural and sort of deeply suburban spaces. And I know Urban League affiliates certainly work more broadly across counties, but certainly you have health departments and centers there that can tell you about their PrEP education efforts. And I would encourage you to partner with them, because it's tragic to be able to go into an environments where people don't know about something that could prevent HIV, that and particularly women who are very accustomed to taking daily pills to prevent things, or taking or an injection to prevent things, right? So contraception has been normalized, or certainly we're rolling backward on that, which is sad and tragic. But again, we have lots of behaviors that particularly Black women have engaged in to prevent pregnancy for years, that similar modules for PrEP, and then and are available for all people. So I just use women as an example of where easy uptake, because we do it already. So yeah.
I thank you both, because I thanks Vignetta for saying pre-exposure prophylaxis and post-exposure prophylaxis is PEP. And I think it's a really important point about women, and the we have a tendency to only look at gay men and say, oh, we're going to give gay men PrEP and PEP, and we are losing out on, or we are forgetting about. I actually have a friend who recently asked her doctor about PrEP, and they told her, oh, don't worry about it. And she was like, no, no, no. I'm going to worry about it. I actually do want this pill. And it was a struggle for, a doctor that she's been with for years who, understands and didn't originally want to give it to her. And she was like, no, you're going to prescribe this for me because I think it's important. So I do think that point about PrEP is for anybody who wants to be protected against HIV. It's important that women, and particularly Black women, know that PrEP is in existence. And the question I want to ask both of you, about stigma. Thank you for that question. And there's other questions. We're going to get to all of them. Hopefully, we're going to get to all of them. I'm going to make sure that we're there. But I do want to talk about education, because I think it's really important. Vignetta, you mentioned it. Douglas, you mentioned it. And particularly for Urban League affiliates, because most of us have education programs. I do want to talk a little bit about, there's a question in the chat, and I was going to get to it, but since it's in the chat, I'll get to it, about what do we see kind of for the future, given what the climate that we're in. I know in particular, just because people should know, Vignetta and I went to school together, several schools together. We're really close friends. I know you do a lot of work on comprehensive sex education, and that's a lot that would help with things like educating what you just said, Douglas, in the school, about educating kids on the options that they have to make themselves stay safe, right? That is what that is. But we are in a environment where there's possibility, or we know that comprehensive sex education can be rolled back. And I just read an article this morning, and we all know that the CDC director who has been nominated has some views that may be against comprehensive sex education. So let's talk a little bit about education. How do we get this message out to the people, particularly our young people, to keep them as safe as possible? And what the environment that we might end up being in is how that could possibly make it more difficult, but what we can do to combat that.
Yeah. I have lots of thoughts here. Do you want me to, what is that? Do you want to start? Do you want me to? The E and ETR is education, and health education more broadly, but HIV and sexual health education being core to health education. And HIV education is not mandatory. And and so there's basics of HIV education are mandatory across all 50 states in the district. But the specifics of what your HIV education needs to look like is not just a state by state thing, it's a district by district mandate. And what we're seeing in the upcoming administration is less and less centralizing of those education mandates. And in fact, certainly a bill was just introduced to abolish the Department of Education, which certainly again doesn't mandate anything curriculum, but certainly supports efforts across the states to certainly be inclusive and environment, sort of disability education, et cetera, and does make very strong recommendations on HIV education, for example. And so less centralization of those efforts means that it's a state by state. And yeah, exactly. George Wooden's in the chat. Yes, exactly. Indiana schools won't let us educate. So it's a state by state and a district by district decision, which is really tragic. We know that if certainly the evidence has shown for decades that we know that if you have medically accurate, inclusive education, and preferably with some skills base in terms of, even things like washing your hands, right? To preventing cold and flu. But if you have medically accurate, inclusive education, all students do better, right? You have better outcomes related to HIV prevention and pregnancy prevention and delays of sexual initiation. And when you don't have that, when you have very stigmatizing abstinence only until marriage, for example, education, you do not get good outcomes. And it was and so the states who actually, and districts who have those actually have higher rates of teen pregnancy prevention. They have later HIV diagnoses, poorer HIV outcomes. And so there's a real opportunity for affiliates to be able to partner even with districts and school boards to educate on the necessary HIV education. There are a lot of recommendations from the CDC currently in terms of what evidence-based interventions have worked. The fear is that some of that will be rolled back in terms of so districts actually won't get the information that they need to be able to sort of best inform science-based decisions for the young people in their environment. So I think the advocacy that Urban League affiliates can do, certainly on a local level, is even more important now that we're seeing that potentially federal oversight may not be, or federal recommendations may not have the prominence that they once did.
Douglas.
What else there is there? That's what she does. There's nothing else to say. Only thing I would add, in the last sentence, Vignetta said advocacy, and I would add advocacy and education.
Yes.
I do think we're going to need our private organizations, such as Urban League. And look, I know it's the Monday after Thanksgiving. People just came back to work and we're saying, oh, we need you to do more. We need you to do more. I think, you know, earlier I brought up my church. I do think partnerships between organizations like yours and Black churches to both around advocacy, but if the climate is as difficult as I think it's going to be, we're going to have to take care of ourselves too and our children.
Yeah.
I don't mean to, we're not going to end on this, but Doug, can you talk about how difficult it could be and what we need to do to shore up or to play defense in like, how is it going to, I need us to be practical, but like, how difficult will it be? Besides what Vignetta said about not being able to, not having the centralized resources to teach about HIV prevention, what do we need to start thinking about and doing now to make sure that we can play the right defense when it comes to this issue and issues for our people in general?
So I would challenge the defense piece. I actually think we're going to have to go on the offense, and we know how to do that. Urban League comes out of, and all our organizations come out of going on the offense. If we are going to develop, we need to develop strategies. And the thing about HIV, it doesn't live alone. Vignetta spoke about this earlier. It lives in the context of our family. I come back to that, my people. It lives in the context of the lives of our people. And going back to the collective action, I think collective action isn't only all of us coming together against HIV, it's all of us coming together with an offensive strategy to protect and save our lives. And I keep going back. I'm a very involved uncle. I don't have kids of my own, but your children are my children, and their lives matter to me as much as the kids whose blood runs through my blood runs through their veins. So we know how to do this. We're smart people. We're thoughtful people. We know how to organize, and we know how to. And I do think this is a Martin Malcolm moment. Not one or the other. It is. Some people go praying, and some people do what they have to do. It's what they did.
I appreciate
Sorry,
that.
that's all I
No,
got to say.
no, I think it's beautiful. I appreciate the offense statement, the offensive statement. I was like, or being on the offense. I was like, I'll get that right. Yeah, it's like the reality of you know, sort of what potentially can be undone. We're talking about the tremendous movement over the past 4 decades to address HIV in this country and around the world is one of our greatest public health successes. And the fact that we get to be here talking about the inequities within is something that even, 30 years ago, we didn't even know that we would be able to talk about, right? And be like, oh, so we're talking about this community within this community, right? Whatever. So to be able to have that science, to be able to have the data to support that, to be able to say, like, this is where we know the epidemic is, let's start, target our resources there. Let's make sure that we know these strategies work because we've had decades of proof that they work. So so I think so maybe different than 1964, right, when we all had to sort of rally together. We actually have a lot of evidence on our side related to HIV. We have a lot of medical advances. We have decades of research on what has worked, and so so I'm hoping that for the affiliates, you're able to certainly say that, right? Say, like, we don't want to roll back on what, we won't go back, right? So it's like, but we don't want to roll back on the progress that we've made here. Here's all of the things that we know work. Let's continue to make them work. And let's continue to have them work. And we can do that. Like, we all know how to do that, right? So when tough stuff has happened to us since the beginning of time. And I would say that Black and brown communities, I think our ancestors have been through worse. And I think are calling on us to sort of step up in this way and make sure that we're honoring the work that they did and the opportunities that we have now that they didn't have, right? So they didn't have the science, they didn't have all the information in the world on their in their pocket, right? They didn't have the dissemination mechanisms that we have for advocacy, right? In terms of sending messages to dissuade, to actually send accurate information and undo these disinformation campaigns that are happening out there. We have the same tools that the disinformation campaign folks have. We have that access. And so I think it's a really unique time for us to be able to have strategies moving forward that lean on all of our learnings of the past and all the tools that we have now to be able to disseminate those messages.
And I want, just because I have the opportunity, the transgender issue is not something that's always easy for us. It is, it's not easy to begin with because it's complex. But and I just want to say, transgender women, Black transgender women who are at such high risk for HIV and violence and murder, they are our family too. They are our people too. And we have to bring our values of family and love and protecting our own and try to understand it. May never be able to be comfortable with the idea of people who are transgender. But if we don't fight for those human beings, our sisters, nobody will be fighting for them, and they will continue to be get sick and be murdered, and that would be a shame.
The most effective way to defeat us is to divide us. So I love what you said, Douglas. I was like, this is not a time for us to do anything other than embrace all of us as necessary, mattering, worthy of collective action and love.
Yes.
Fantastic. Couldn't say it better myself. So we only have about 9 minutes left, but I do want to get to this because it's important, because both of you are such pillars in the community. And so I want you to talk about what has been your proudest and or biggest achievement in the work that you've done, in your careers. So on HIV prevention. It doesn't, and because I know the reason why I said biggest and or proudest, because sometimes the biggest moment is not the proudest moment. Sometimes the smallest actions are the proudest ones. So that's why I'm giving you the leeway to go biggest and proudest. And then we'll talk about some wrap up. We have a couple of questions, I think. But I do want you to talk about that, because I think it goes on to Vignetta's point that there has been successes. We've done a lot. since the epidemic has started, and we also need to champion those successes because those successes were built on hard fights. And so either one of you can start.
I was at a dinner last night after we left the White House. The current ONAP director, Francisco Ruiz, invited as many as could former ONAP directors for a dinner, and it was really quite special. And that question, actually, a similar question came up. It's, I think for me, I would say my proudest moment, a moment where I thought, oh, this has all been worth it. This is all good. When you leave the White House, you get what's called an exit photo with the president. And when you've worked in that particular office, the executive office of the president. And the day, both my parents are gone, but I have an older sister with whom I'm tremendously close, and nieces and nephews. And the day we all walked into the Oval Office, and the first Black president of the United States of America turns to my sister and says, "The work that your brother has done here has been amazing and such a contribution to our country." And he just was he was so kind and so glowing. And to see the look on my family's face as President Obama spoke these words in the Oval Office was certainly the proudest moment. The moment for me, I talked about this early, that feels like a significant contribution that I was able to make, in addition to the strategy, was getting this major corporation to truly invest in the Southern United States, in particular, with clarity that doing so was addressing racial, Black racial injustices and inequities. It was, yeah, that was a highlight.
It's a big deal, Douglas. That's a
I
big
know. I
deal.
was gonna say that's why
Okay,
I should have gone second. You should have gone last. Yeah, he's like President Obama, and I was like, I went to Target. So I'm getting all goose bumpy. I was like, I'm so proud of you, Douglas. I was like, that is I
Right
know
back at you.
that's so beautiful. And I knew you went. I would say I don't even know that I don't know what proudest moments are, so it's like I'll choose one that I think is thematically makes sense for what we've been talking about here. And so this was um I think it was about listening to communities and then seeing what strategies are really working. And so so the Positive Women's Network of the United States, which is a advocacy group of women living with HIV, had partnered with UC San Francisco Women's HIV program, which is one of the longest running HIV programs, to do a study on the impact of women violence, trauma, and HIV. And so they had done a study, and they'd done some work group experiences. And Dr. Eddie Mochtinger, and then the executive director of PWN USA, Nana Khanna, at the time, had come. I was senior vice president at AIDS United, and then said, "Hey, we did this thing, and we really want more, sort of federal partners involved. We want more, so private funders involved. Like, so we want to do a thing." And so it was based on the platform that I had at AIDS United, certainly, and the access that I had. But we we got someone to fund a technical summit on women, violence, and HIV, and we did it in DC. We did it around Valentine's Day, and then we were able to organize a congressional briefing right after in the White House in partnership with the Office of HIV/AIDS, OHIDEP at the time, and ONAP. Office of National AIDS Policy. So we had a technical summit one day. It was like freezing cold. There was a snowstorm, and we had federal partners show up, right, from federal agencies, so the Office of Violence Against Women, from Maggie Tornagorski, who had been working with Douglas at the time, Office of National AIDS Policy, Amy Lansky at CDC. We had those folks show up, again, in the middle of a snowstorm in DC with community advocates and academics, and we had this incredible facilitated experience. Then we had the congressional briefing the following day, and then after that, there was a federal interagency working group that was that moved forward to address women violence and HIV. I think it was a proud moment because I was like, it's not like I implemented. I connected some dots and then used the platform that certainly had been God given to me to be able to sort of facilitate folks coming together, and there was really a lasting impact related to that, and people really showed up to show their commitment. And that's why I say the snowstorm, right? Like no one comes out in DC in 2 feet of snow, and people were like, we're going to trudge through the snow to get here to talk about this thing. And so, which primarily impacted Black and brown women, I will note.
I love it. Okay, so we got 2 minutes left, and I'm going to get to these 2 questions. One, we actually were talking about this right before we started in the full session, and I just want to acknowledge that Michael Strayton talked about the loss of Cornelius Baker, who was a prominent HIV activist, and his obituary was in the New York Times this morning, and Doug is actually quoted in his obituary because he was a colleague and a friend. So I just want to make sure that we talked about that, because thank you, Michael, for mentioning Cornelius Baker, because it's an important person that we need to acknowledge, and his memory and the work that he's done, the work that he did in being an HIV activist. So that's important.
Before we go off Corny, I just want to note a couple of things. So I think both Douglas and I, obviously, I'm personally undone by sort of the passing of Corny, but I think we texted right after, and one of the things that I texted to Doug was that the sort of core piece that I learned from Cornelius was the power of human connection, and that was something that was just sort of core to how he showed up. It was core to how he presented himself in the world, and so as the affiliates think of ways to honor that wonderful legacy, I would say that is about sort of the connection and working as a collective. So just want to honor him and say that you all have the opportunity to honor him with that as well.
Which is also related to the second question that Michael asked, and that is, should Urban League a partner? And I read that question and I wrote, yes, Blacks for gays and gays for Blacks. I do think, and that's not, it's not always been, when marriage equality passed in Massachusetts, and Deval Patrick had expended a lot of his political capital on getting that to pass. And we were in the celebration that night, and he said, now that this is done, there are people who need your help, and we need you to help Black people who are struggling. And the applause was so tepid until it almost broke my heart. I think a lot of things have changed. The two largest LGBTQ organizations are now led by Black women. Each of the two are led by the task force, and HRC are both being led by Black women. And I actually know there would be warm reception to an Urban League, HRC, task force conversation. I volunteer to help make that happen, to make those connections. And funny, just before I came on this webinar, I was like, okay, I'm old now. This is going to be one of the last of these I do. But I will say, I would help with that.
I'm going to hold you to it, Douglas. I'm going to hold you to it. And just so folks know, the question was about Urban League, particularly in Georgia, connecting with LGBTQ, human rights, and other organizations to work through HIV prevention. Okay, we're over time, but I just want to make sure I give you both last words. If we're talking about ending the epidemic, I just want your last words on what we can do as a collective to think through making that happen.
I know I should give Douglas the last word because he'll be like, President Obama. I don't know what that is. I mean, I think the thread has happened here. It will take all of us. So the real, and we've done this before. right? So, you know, sort of tap into all of that energy, so we can and know that we can do it, and know that we've lived this, and we can thrive, not just survive.
A meeting between the National Urban League, HRC, and the task force.
I love it.
I love it. I love it. Thank you both so much. Thank you for everybody who's on the call. Dr. Charles, Douglas Brooks, thank you so much for taking the time. I know you all don't do this often. So I will just say, I have to say to this group, this was a personal favor for me on both of these folks' parts. They don't normally do these types of webinars. As Douglas said, you know, he's retired and it's just like, I'm living my life, but he did it as a personal favor. And so I just want to really appreciate it. And also know that many people have asked them to do World AIDS Day activities because of their prominence in the field. And so the fact that they accepted the offer from the ask from the Urban League is greatly appreciated. So I just want to say thank you to both of you for all the work that you've done, the continued fight, and we will make those connections. We will work as a collective to help our people and make sure that we do end the epidemic sometime soon. And I just want to say thank you. Have a great day, everyone. Have a wonderful holidays with your families. Hug them, love them, because it's important, because as we said, we have to take care of each other. So thank you so much. Have a great day. The webinar.
Thank you, Lydia.
Thank you to Cytokinetics. Sorry, also I was supposed to thank Cytokinetics, who is the one who sponsored this webinar. So thank you to Cytokinetics. They have been a wonderful partner in helping us get webinars like this out and into the ether. And so this will be on our YouTube page. And so thank you all. Thank you, Douglas. Thank you, Dr. Charles. Have a good day.